Conversations are underway right now to determine whether more COVID-19 patients will need to be transferred out of Saskatchewan as its critical care needs bust capacity limits. 83 people are now in the province's ICUs, and Saskatchewan reported 8 new deaths today. Premier Scott Moe is in Regina. Premier Moe, I'd like to ask you first about how many more patients you expect to have moved out of the province. Originally, it was 6 patients who were being sent to Ontario. Are you expecting more patients to have to leave your province to get critical care for COVID?
Well, we may, and we'll have those discussions later this week. What we are doing right now is we're in the process of moving six ICU patients out of Saskatchewan into Ontario. That'll take us until Wednesday, and I think our Joint Command Center that is handling our COVID response will then have discussions as we near the weekend as to whether there's some additional patients that need to be transferred as well. And I'd just like to take the opportunity to thank Premier Ford and all those in the Ontario healthcare system and the province of Ontario for allowing us or providing us with this capacity that we need at this point in time.
CP24, a local 24-hour news station in Toronto, is saying that it's obtained documents from the Ontario government or Ontario officials that say another 6 patients are coming for a total of 12 in the next week or so. Is that accurate?
Yeah, those discussions I'm sure are happening as to, are there additional patients that will need to be moved. And as I said, there's 6 patients that'll be moving until Wednesday, and then those decisions will be ultimately being made, or the recommendation will come ultimately to the government from our Joint Command Center. And if we are able to move 6 more patients, do need to move 6 more patients, and Ontario has the ability to take those, as I said, that decision will be made later this week.
I want to take a step back here and ask you, from your perspective, how did this happen?
Saskatchewan is having a very challenging time with the 4th wave of COVID-19. Here in this province, we've done relatively well up until late this fall, where we've ran into some high case rates, ultimately resulting in some high hospitalizations. And we have implemented a number of public health measures. One of the earlier provinces to move on a proof of vaccination policy here in Saskatchewan, which has greatly increased our vaccination rate. We're up over 75% of folks are fully vaccinated. I believe we'll hit 85% tomorrow have their first dose. So that is a marked improvement. And our numbers are starting to drop. Months over last month, our numbers are dropping. Our hospitalizations, even in the last 10 days, have started to drop. However, our ICUs still remain at too high a level here right now, but we're hopeful that in the next number of days and weeks that they will also come down.
But Premier, you say, late fall, that this is when the challenge of the 4th wave really struck. But we've been hearing from those on the front line who have been pleading for help for weeks. There was a letter on August 26th from medical officers of health from across the province pleading with the provincial government to do more. And weeks before that, many doctors had also flagged that measures were needed. Why did your government ignore those pleas from those people on the front line?
Well, they weren't ignored. As we got into September, the government did act on a number of significant public health measures, including acting and being one of the.
But it took months. But Premier, with respect, and I don't mean to interrupt, but with respect, it took months. You rolled back those public health measures back on July 11th, and there weren't any new changes until I believe it was September 11th, September 10th. That's when changes happened. What took so long when so many people who are on the front lines are pleading for help?
As you said, there was a letter from a number of physicians at the end of August, and the move was about the middle of September. So it took weeks, not months, with respect to for the government to act. And I had said openly yesterday and today on a number of interviews, should have the government acted a week or 2 earlier than when we did here in the province with reenacting a number of public health measures? Quite likely we should have. In hindsight, we weren't able to meet the ICU capacity that our Saskatchewan Health Authority had put forward. We have expanded our ICU substantially, but we weren't able to meet the capacity that we had put forward. We did reinstate a number of significant public health measures. Those public health measures are proving to be effective today. But in hindsight, as we look back, we likely should have moved a week or 2 earlier than we actually did.
Who is to blame for this crisis?
This is a pandemic. There's no people to ultimately blame out in Saskatchewan or across Canada. We've seen the pandemic that has hit. This pandemic has hit various regions of Canada harsher at certain times than other regions. And right now, it's Saskatchewan, Alberta recently as well has been through quite a challenging time with the fourth wave as well. But we're not out of the woods yet anywhere in Canada, and I think there will be additional challenges that we're going to have to meet and most certainly meet and support one another together. In earlier phases of this pandemic, Saskatchewan had supported other provinces, and we're really appreciative of the support that we're receiving from other provinces, namely Ontario right now.
You say that there's no one to blame here, but you're the premier of this province. The decisions made by your government led to this point. Should you not be taking some sort of responsibility here?
Well, I did say with respect to when we had made this decision in the middle of September, albeit we were one of the earlier provinces to move on the proof of vaccination policy that we'd put in place. Quebec had moved about a month earlier, and we likely should have moved on some of those policies, as I said, a number of weeks earlier. Would have helped us with our ICU capacity like it is now helping us with our case rates, which are declining, and our hospitalizations, which are also starting to decline.
So do you personally take any responsibility for the fact that the healthcare system in your province is in a state where critically ill patients with COVID-19 have to be flown to another province?
Like other provinces have had to do this in previous waves, Saskatchewan is relying on some of that support that's being provided by Ontario here today. We ultimately are the provincial government in Saskatchewan, and so the decisions that we have made, trying to balance the freedoms that people have in this province with the safety and how we can manage and learn to live with COVID-19. Most certainly those decisions are made, like in any other province, by the provincial government here. And we're going to continue to work with and listen to the people of this province as we find our way through this COVID-19 pandemic and learn ultimately how to live with COVID.
The thing is, we're more than 18 months into this pandemic, and scientists and doctors have learned a lot about how it spreads and how public health measures can help blunt the spread of this. We've seen other provinces go through very difficult times. I'm just curious as to why your province didn't learn the lessons from those other provinces that went through extremely difficult circumstances here. Do you not see this as something that was preventable?
No, for sure. And public health measures are part of what are in place in Saskatchewan as we speak. But there are other tools as well that are becoming available that we didn't have in the early days, namely vaccines. And they are the most effective tool that we have. But there's other early intervention treatments that have recently become available through Health Canada. Things like monoclonal antibodies that Saskatchewan is going to make available in short order to the people here and will help keep people out of hospitals. We're trying to bring in a number of non-mRNA vaccines as well for those that may have concerns with the mRNA vaccine. We don't want any hesitancy to putting yourself out to get a vaccine here in Saskatchewan. And we're dispersing the rapid testing kits to communities right across Saskatchewan, which is our first line of offense with respect to COVID-19. So we do have some tools available in the self rapid tests, the early intervention treatments, and ultimately the vaccines that showed up earlier this calendar year that we just simply didn't have in that first 8 or 9 months that we were managing our way through COVID-19. All we had was that very blunt instrument, public health measures in those early months. We're going to utilize all of the tools, including public health measures here in this province. It is working. Our case rates are dropping, and we need those to continue to drop in the weeks and months ahead.
The thing is, when provinces were discussing vaccine mandates, you originally described them as heavy-handed. And I believe if Saskatchewan doesn't have the lowest vaccination rate, it is among the lowest in this country. Are you concerned that your initial comments may have added to the vaccine hesitancy when you describe things like these measures being heavy-handed?
They are heavy-handed. These are not measures that governments should look to, without some very serious thought. The same goes for public health measures, which are also very heavy-handed. And, we as a provincial government in Saskatchewan have implemented some of the most stringent public health measures on Saskatchewan people, likely in the history of our province. And each of those should have, very much have a discussion and debate around whether or not they're going to be implemented and ultimately what their effectiveness can be. That being said, we have had to again put in a number of public health measures along with a proof of vaccination policy, which is working. We've had over 125,000 shots that have been delivered since we put that policy in place, which has increased our vaccination rate 3 to 4 times on a daily case rate. Our daily vaccination numbers is up 3 to 4 times. So the measures that we have put in place are effective. They are working, but most certainly they shouldn't be put in by any government as a first or without much thought, discussion, and discussion around what the outcomes of those very impactful and strict public health measures are.
I'm going to ask this one more time, and it's my last question here. I've sort of asked a couple of times around this. Do you see yourself as personally responsible, or where should the responsibility lie for what has happened in your province and the state of crisis that exists right now in your ICUs?
Well, as I said, we've made a number of decisions as a government, like other provincial governments have. But at the end of the day, what we're all managing our way through in this country and in this province and in our communities is a global pandemic, unlike anything that this generation or really anyone has seen in Canada or the world for quite likely 100 years. It is a significant event. It is the challenge of our generation. Ultimately, provincial and federal governments are responsible for making the decisions, the various decisions that we've been required to make throughout this. And in Saskatchewan, we are the provincial government. And so, yes, we do bear responsibility with respect to all of the decisions that have been made throughout this pandemic. And we're going to continue to listen to Saskatchewan people as we find our way through what has been a very challenging fourth wave here in our province. So
you accept that you need to take personal responsibility, and do you feel the need to apologize for what's happened and to the families that have had to send their loved ones out of province?
Well, the folks that we have sent out of province here is to ensure that they can receive the very best care that is available, and so that we can preserve some of our buffer capacity here should we have a significant event where we need some additional ICU beds. And so, if there is an impact, it's across our healthcare system where we have slowed and stopped a number of services that Saskatchewan people normally would have access to, and we want to bring that access back to them as soon as possible. But we've had to slow those services to support the expansion of ICU beds in our province, which is largely filled with folks that are not yet vaccinated. And so, if there is a responsibility or an apology that I would deliver, it would be to those folks that have not been able to access those services. And we're going to do everything that we can to get our healthcare system back up and operational so that they can access those services as soon as possible.
So do you apologize?
I think I just did to those folks that haven't been able to access services across the healthcare system.
Okay, Premier Moe, thank you for your time today.
Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.